The healthcare sector in the UK and across the world faces significant challenges. On one hand, we have an overwhelming increase in the demand of healthcare due to long-standing challenges such as an aging population, unhealthy lifestyles, mid-term challenges such as climate change, and more recently, the pandemic. On the other hand, our workforce is at a breaking point. We have an aging estate, our healthcare providers are undergoing major changes from integration to aligning to net zero. And so understandably, the pressure on healthcare has reached a critical inflection point.
Given the complex set of challenges that we face today, we think you need an approach that's truly holistic. The piecemeal approaches of the past aren't going to work given the number of drivers that we have. Indeed, our approach is based on taking a short-term, medium-term and long-term view, and I'd stress that those are in parallel, not sequential. In the short term, we need to recover from the pandemic. That's going to be a complex challenge. Currently, there are 6 million patients waiting for treatment. That might actually be significantly higher with the number of people that haven't presented yet. In the medium term, we have the challenge of the introduction of integrated care systems in June. And beyond that, we have to address the significant issue of the underlying health of the population. The Secretary of State indicated that their view was 50% of the population is actually suffering from illness that is self-created, lifestyle. All of those issues need to be dealt with in parallel, and that's why our approach looks at the short, medium and long term. In the short term, recovering from the pandemic, in the medium term, integration, and in the long term, public health. As we do this, we need to understand what constitutes a sustainable healthcare system. In my view, a sustainable system is one that is efficient, effective, but both economically and environmentally sustainable. The NHS is responsible for something in excess of 5% of the UK's carbon footprint. We have to address that along with addressing the underlying drivers of healthcare. And at the very heart, we believe that putting the patient at the centre of care is critical to doing all of the above. If we take a holistic view that puts the patient at the centre of care, we can make a significant difference.
As climate change accelerates globally, in England we are seeing direct and immediate consequences of heat waves and extreme weather on our patients, the public and the NHS.
The climate and ecological crisis is a health crisis. The release of toxins and carbon emissions from human activities is generating extreme weather events, rising sea levels, marine, land and air pollution, which are having significant detrimental effects on human physical and mental health, as well as the biodiversity on which we all depend. This is increasing demand on the healthcare systems, including our own NHS, and presenting risks to the supply chains on which those healthcare systems depend. In 2019, the NHS emitted the equivalent of 25 million tonnes of CO2. That's almost 5% of the UK's total carbon footprint. And recognising its impact, it's taken action, setting a plan and a target to deliver net zero on all its emissions by 2045. And it clearly expects all stakeholders to take action, including the supply chain, itself responsible for over 60% of those emissions. The Gemserv Health team works with NHS providers, integrated care systems and the supply chain to address these challenges, developing green plans, sustainability strategies and new models of care in order to improve population health, increase efficiency and deliver economic benefits. Gemserv as a business is uniquely positioned to support accelerated decarbonisation of the healthcare system with subject matter expertise in areas from digital transformation, low carbon energy and mobility, food, pharmaceuticals and culture change. We put people's health at the centre of everything we do. I particularly enjoy working with clients to recognise and deliver those measures that will improve population health and well-being while reducing environmental impact and delivering efficiency and economic benefit, leaning on my own experience in the NHS and the wider healthcare and Gemserv business to do that.
With the current challenges such as climate change, the elective care backlog, and an extremely fatigued workforce, models of care and clinical pathways must respond, adjust, and sustain change.
So when it comes to service transformation and really resolving these long-standing barriers in healthcare, you really cannot sustain change, especially in clinical pathways, when you look at it from one perspective. You really need to look at change holistically. So there are mechanical changes. You need to make those changes in operational processes, for example, in bed reconfiguration in elective care, or when you decide how the patient flows from location A to location B. But then you have this underlying mechanism or this underlying factor that sometimes a lot of people forget, and that is really a mindset and cultural shift to create that psychological safety for change. And I believe we at Gemserv, we do that very well. And that's one of the reasons I really enjoy working with my team here at Gemserv, because we really believe in people over products and processes. Here at Gemserv, we've done a great job at actually acting on that mantra to really bring those perspectives together. We've shown that in our client work. For example, when we've worked with the Association of Generic Medicines, the BGMA, we've been really able to bring a client's perspective, a patient's perspective, and look at the impact of the work that they are doing on the patients at home. On the other hand, we've been working on the ground with clinical directors when transforming clinical pathways, for example, and really bring that supplier side and that supplier perspective into play as to what would these changes mean for the suppliers, or what would these changes mean for the net zero commitments that we've made.
At Gemserv, we have a unique set of values, but there's three I'd draw attention to. The first is that we understand the complexity of the problem. Our experience across multiple contracts in integrated care systems, health system recovery, digital transformation give us a complete view of the challenge that's faced. The second is that we believe passionately in patient centricity. Putting the patient at the centre of care is vital. And the last is, as individuals, we are absolutely passionately committed to making a difference. And that's why I'm so proud to lead this business.